So of course, my first answer is prevention is better than cure. So mask yourself up, put your mask above your nose and below your chin, and don't let it drop down like your jeans drop down. There is a method to wear your mask. You should do that. In terms of drug usages, any viral infection, and that's pretty true for COVID. So 60 to 65% of patients are going to be mildly symptomatic or what we call as asymptomatic. When we say mildly symptomatic, could mean fever for a day, some body ache, mild cough, a little headache, and then there could be just complete silence of the disease and they would pass by. Such people, mildly symptomatic or asymptomatic, as we've discussed, should only be under home quarantine. They just require good, adequate nutrition. That means good, adequate food, good water and hydration. And maybe if they want to take some vitamins, they certainly are eligible and comfortable. They may take some vitamins. For example, vitamin C, zinc are the commonest used vitamins. One orange will give you enough of vitamin C. Zinc can be procured by just eating green leafy vegetables. And you can, of course, bank on any vitamin that contains zinc. The other thing that comes is for moderate to severe disease. Even moderate patients can be well monitored at home under a strict surveillance, and they probably require just supportive therapy in terms of the vitamins that I spoke about, in terms of keeping themselves isolated, and some specific drugs can be used. We do have an oral drug, and that's called favipiravir. Favipiravir is an antiviral. It's not a wonder drug. It decreases the duration of sickness and illness. It does not prevent you from getting into severe infection. So that's one drug that we commonly use for moderate disease. It's best begun early in the disease, but can be begun up to 8 to 10 days. When you come to steroids is not to be used on the day of diagnosis of COVID-19. So this is a misnomer. You should not use it immediately. There's a specific time. There's no deadline to say that it's day 4 and day 5 I can't use it, or it's day 5 I must use it. So it depends really on the clinical condition. The best period that I've seen is after 4 and 5 days. They certainly have a role. They must be taken under medical supervision and not from the chemist as an OTC drug and popped in as in and when in basis. Third comes to severe infections or moderate infections that require oxygenation. So these patients should be in hospital. The biggest problem that we see is we are more actually frightened than hurt, and we actually die of imagination than reality. So the moment you're diagnosed with COVID, I don't want you to go and block Manipal Hospital or Fortis Group of Hospitals or any of the hospitals, any place. These are for the sick people. We have remdesivir. You spoke about remdesivir. This is an intravenous antiviral. The mandate is that it's indicated and approved for emergency use. Data at this moment says it does not save lives. It's not a wonder drug. It must only be given in a hospital setting. There are clear-cut mandates. It's to be given early in the disease, can be used up to 9 to 10 days. One extremely important point for our healthcare workers, that you do not require to use more than 5 doses of the drug. So using 5 doses or using 10 doses, the difference is nothing. The outcome does not differentiate or vary. So do not waste those extra 4, 5, 2, 3, or even 1 remdesivir. We will be using it to save someone who actually requires it. So remdesivir is not a wonder drug. To me, I think it's a good drug. The data at this moment says it doesn't save lives. It just shortens the duration of hospitalization. But if I were to just expand my thought process, if you shorten the duration of disease, thus you may prevent complication and may in turn prevent death. So to me, it's a drug to be used by the medical practitioner in hospital, and it's a great drug. Then you have other specific drugs, interleukin-6 inhibitors like tocilizumab. You have newer drugs, the anti-cancer drugs that you have. They are also to be used. Interleukin-6 is a test that every common man on the street does it. It's not a dependable test. I have had patients at home, not one, hundreds of them, who are interleukin levels are 20, 30, and even thousands. And then they say, Doc, do I need tocilizumab? That's ridiculous. Do not treat the report, treat the patient. It's to be used only in a hospital setting. My appeal on your show is do not hoard the drugs. Do not hoard oxygen cylinders. Don't save remdesivir or tocilizumab because you have strength to get it, black market it. You are actually killing someone by storing that for your day, which you may never see.